El Reno Police Chief Mike Holden to open up our town hall.
Thank you, and thank you for being here tonight. Thank you to those of you who are joining us via social media. Again, my name is Mike Holden. I'm the Chief of Police here in El Dorado. And tonight we've invited you here to talk about an issue that has been plaguing our community for far too long: opioid abuse. It's a problem that has affected people of all walks of life, and it's something that we can no longer afford to ignore. Opioid abuse has become a major public health crisis in our country, and our community is no exception to that. We've seen too many lives ruined, too many families torn apart by this epidemic. But we're not powerless in the face of this problem. There are steps that we can take as a community to combat opioid abuse and ensure that our loved ones and our neighbors are protected. First and foremost, we need to raise awareness about the dangers of opioid abuse. Many people who become addicted to opioids do so unintentionally. Often, they become addicted through the prescription or through prescriptions such as painkillers caused by an injury or some sort of medical issue. By educating ourselves and our community about the risks of opioid abuse, we can help prevent people from falling into this trap. Secondly, we need to make sure that those who do become addicted or are addicted have access to the resources that they need to recover. This means investing in addiction treatment programs, counseling, and support groups. We need to make sure that people have a safe and supportive environment in which to heal and to recover. Finally, we need to work together as a community to reduce the availability of opioids. This means cracking down on illegal drug trafficking and working with doctors and pharmacists to ensure that opioids are prescribed responsibly and only when absolutely necessary. The opioid epidemic is a complex problem that requires a comprehensive solution. It will take time, it will take effort, and it will take resources. But we cannot afford to sit back and be silent. As a community, we must come together to fight this epidemic and help protect the health and wellness of our loved ones and our neighbors. Thank you.
So today we have a group of experts from various fields here to share their knowledge and experiences related to fentanyl use and prevention, and we will be opening the floor for all of you to ask questions with whatever the community has questions for. So if our panelists will smile and wave when I say your name. Our panelists include Scott Stevens of Butler County EMS, Dr. Crystal Padre, Shannon Stabler from South Central Mental Health, Chief Mike Holden, Kelly Paye representing the schools, Jennifer Clausen from True Care Pharmacy, and Stacey Haynes from DECA. Each brings a unique perspective and area of expertise to this discussion, and so we will be asking lots of questions, a handful of which have been submitted in advance from the public, which we will be going over. And again, like I said, our great volunteers, Phil and David, will be heading around with microphones near the end, where we'll have an open Q&A discussion. So start thinking of your questions now. So before we get started with the questions, we'd actually like to start with Joe and Amy Gerber, who are here to share their personal story surrounding fentanyl with all of you. So please help me welcome them to the stage.
Well, good evening. My name is Joe Gerber, and I'm superintendent of Remington Schools. This is the first time that I've ever talked to a group about my son's story. And I can tell you this right now, I don't know what all of your personal experiences are with what we're talking about today. We certainly wouldn't think to judge anybody in here, because we're not here to do that. And our story and our opinion may or may not apply to your individual situations. We certainly learned that. More than anything, we want to help people. We decided very recently, I responded to an email from Phil Benedict and from Kayla that I told them I had a story and decided it's probably time to tell it. It can happen to anyone. Quote unquote great kids, troubled kids, quote unquote good families, troubled families, doesn't matter. Number 3 is extremely addictive. Once someone starts using, it's our belief it's almost impossible to get off on your own. The key to us is never starting. Number 4, another goal for this evening, Suboxone may be an important part of recovery. That's what we found. Number 5, our district, USD 206, has Narcan in all of our schools, and we're trained in its use. Every school district should. And number 6, some addiction centers are way behind when it comes to addressing this relatively new issue. Although there are similarities to other addictions, this one we feel like is unique. People say to get help. Well, of course. But the help you get is very important, as not all addiction centers are close to being the same. Like I said, I'm the superintendent of Remington Schools. Prior to being here, I was a principal for 11 years and 4 years as assistant principal AD. Amy is a nurse at Duke Medical Center, has been for many years on the maternal child unit. We have 6 kids, and the one we're talking about is our oldest. Our son was and is bright, very smart, intelligent, an intelligent young man. Academically, he was the top of his class in high school, senior class president, 34 on his ACT, 3-sport athlete. I can tell people, the game-winning shot in the state finals of the state tournament his junior year. 2-time champion in track, starting quarterback on the football team. He was in band, multiple musicals, active in his Catholic faith, attending Mass every Sunday, and serving at Mass.
So this is kind of just a timeline of what happened to us. He went to college with a presidential scholarship. He went to fly commercial airplanes. He was accepted to the Air Force Academy and had lots of offers. Before attending college, we realized he dabbled with vaping, alcohol, marijuana. I say marijuana and Delta 8 back and forth because he does as well. That's how he addresses it. They both have the THC in it. We confronted him and got very angry. We could not believe our son would vape. And the pot use stunned us. His first semester at Heston College, he moved from vaping, alcohol, marijuana use to occasionally harder drugs, including cocaine and what he thought was Percocet. Marijuana was daily, and he said it affected him differently than it affected his friends. He said he was instantly addicted, and that was the gateway for him. His friends could come and go with it. He needed it daily. He agreed to see a counselor. We began drug testing him at least weekly in the summer. He stayed with us between his freshman and sophomore year of college, and that was a long, terrible summer. He got around the drug tests. He began testing clean, but we weren't seeing any change in his personality, and we were really confused. He got around the tests. November 2020, he dropped out of school. He came home, and he was with his girlfriend alone. In June of 2021, he was arrested after local law enforcement found him with drug paraphernalia and a pill in his car marked like Percocet. He went into rehab and they tested it, and he was shocked to find fentanyl within his system. There He remained vigilant, attending Narcotics Anonymous, and he stayed clean for about 60 days and relapsed, first back into alcohol and marijuana. He moved in with his grandparents after frequent arguments with us. November 2021, November 18th specifically, Joe's mom found him unresponsive on her bathroom floor. He appeared dead, and an ambulance took him to St. Francis, where he was put on a ventilator, treated, and released 3 days later. He was released without any plan, any assistance from the hospital, no guidance, no direction. On November 24th, 2021, 6 days after his first overdose, he was in our home, and he had been up till 2 in the morning. It was 2 days before Thanksgiving. He had been up talking to his little brother until 2 a.m. the night before. His little brother was 15. And his little brother had basketball practice the next day, and he came and woke me up about 6:30, and he said, I can't wake up, Randy. So I ran downstairs, and he was face down on his mattress, not breathing. I yelled at Joe to call the ambulance, and Joe called the ambulance. Because we live in a tiny town, he had to stay upstairs to get cell reception. And I gave Narcan and did CPR on him for 20 minutes till the ambulance arrived. Our oldest daughter was gone, but all of his younger siblings were home. And they saw while he was carried out by the ambulance. It was chaos. We thought he was dead. We thought he was blue when I found him. We were shocked. I thought he was at least going to be brain dead. And we did not understand how he could possibly overdose twice in 6 days. He spent 3 days at St. Francis again this time. We refused to leave without guidance. And despite it being Thanksgiving weekend, a little bit of guidance was offered before he was released back to us. But once again, we had no idea what to do. Eventually, he entered rehab again, this time in California, and we were trying to find the best place he could. He actually found the place. We just started calling everywhere. Upon arriving in rehab, I found out he had COVID, so he had to be isolated by himself for weeks when he could have been getting treatment. He was in inpatient treatment again for 30 days and then entered a halfway house. This was successful until April 2022, when it was clear to us he was using marijuana and alcohol again. We went out to see him in California in May 2022 and could not get him back on the right track despite our best efforts. We were heartbroken as we knew what was coming. And sure enough, June 16th, 2022, he overdosed for a third time in 7 months. He was taken to a hospital in LA around 10 p.m. and released by himself at 4 a.m. with no taxi, no car, no guidance. We were in Kansas and flew out immediately, and through a lot of coercion, got him to come back home. He agreed to take Suboxone while he was here, but he began vaping Delta 8 and Delta 9 that are both legal in the state of Kansas. Living with us, once again, was difficult, and he eventually moved in with his grandparents who lived in Parsons, out in the country, and he remains there today, and he's been free of opioids since. He's no longer on Suboxone, and he's maintained a job, and he's doing well right now. So that's our timeline.
What we have learned is that he's alive today because of the power of prayer in our minds. He wouldn't be here without the Lord our God and his Mother, whose intercession on his behalf is the key to his improvement. If you don't hear anything from us, then this is the most important thing to say. This entire experience has humbled us. What did we do wrong? How did this happen? What did we miss? We're supposed to be professionals in education and medicine. The southern border crisis was on our doorstep in tiny Elton, Kansas. In my mind, the federal government's failure at the border has drastically affected my son and my entire family. The lack reaction is infuriating, it's disheartening, it's absolutely unexplainable. How many deaths would it take to get the federal government to do their constitutional duty and protect Americans? I cannot believe our government doesn't see this as a national emergency that it is. We've sent letters to our elected officials, both our senators and our representatives. In January of this year, I received nothing back. You're not alone. Your local police chief is here. That's a start right there. And El Laredo's doing something clearly. But I'll say this: you got to be really active. You got to be very proactive. The estimated number of deaths in fentanyl in 2021 alone is 100,000. Those are the ones we know about. Rehabilitation centers, as I said, I think are woefully unprepared for the current crisis, despite their best efforts. Undoubtedly, there are mental health rehabilitation services that are successful. Our experience with them was not overly positive, both in terms of results and insurance issues. And if we have insurance issues, we know that a lot of people do. Upon research, the relapse rate in such facilities is very high. Simply saying more money to mental health services will not yield more positive results. We have to understand that fentanyl is different, and I'm convinced that we don't. Suboxone drugs like it are the start of addressing the issue, but they are painstakingly difficult to get, even for me, a superintendent, and my wife as a nurse. I believe that without family support, our son would most certainly be dead. My wife and I have a strong marriage for 26 years. Those who have addiction problems without family support, I can't imagine that. Little access to health care, little access to things like Suboxone, very little chance, it seems to me, of making them when they're hooked. He was arrested in June 2021. He was released the next day, and it wasn't resolved until October of 2022. So that was about 16 months of him not knowing what was going to happen to him. And I know that the criminal justice system is overwhelmed with cases, and so I feel for him. And at the same time, our experience there was him waiting 16 months to get the issue resolved was pretty remarkable to me. He spent of his own money over $6,000, and that doesn't include lost wages in the criminal justice system. He offered to assist law enforcement on numerous occasions to bring the people who sold him pills to justice. I was there when he said it. This was not followed through on, despite my wife and I talking to our local district attorney. Anyone who says marijuana, including legal vapes, Delta 8 and Delta 9, are not harmful, I think it depends on who you are. I would love to talk to them. It's where it all started in our situation. I don't know how Delta 8s and 9s are legal in communities. As an administrator in our public schools for almost 17 years, I now know at least 4 of my former students have died from drug overdose. This is staggering and heartbreaking, as the schools that I've been in are all small. We did find out who his true friends are. 2, it's a very, very, very small number of people. 1, we are convinced that the reason he's doing so well now is our prayers, as I've said, and the prayers of other family and friends. Prayer is something that cannot be underestimated in treating addiction, and we haven't underestimated it. Thank you.
Thank you so much, Joe and Amy, for your vulnerability and for sharing your story with us. I cannot even fathom what you've gone through, but I appreciate you being here to share it with all of us. So next we'd like to move to interview our panel. Scott, you're on deck. Get ready. Using questions pre-submitted from the public. So at the end, like I said, we'll be opening up questions where Dave and Bill will be coming around with microphones. Okay, so Scott, you're from Butler County EMS. I first want to just asked, what is the scope for us? What does the fentanyl crisis look like for us here in Butler County?
Here we go. Currently at this time, there are multiple cases of fentanyl overdoses that we're seeing throughout the county. Over the last 5 years, we've seen over 620 cases of overdoses within the county, with multiple doses of Narcan being given for those people. I can tell you that year to date, it's been over 106 cases. So, looking at where we started from 5 years ago to now, we've seen a gigantic increase in the number of overdoses that we've seen this year.
You mentioned Narcan. Could you explain that for all of us what Narcan is and how it's administered?
So Narcan is what we call an opioid antagonist, which basically means it blocks the receptors, or it stops the ability for the body to use opioids for a short time period. Narcan is usually given in a hospital setting. It's given through an IV, but it also can be given through the public now through an intranasal spray. There's a lot of pharmacies out there that are giving out these, or that are using intranasal sprays, and it's just placed inside the nostril and sprayed. One of the important things to remember is that someone has to have a pulse in order for that to work.
So, you mentioned Narcan as a way to kind of interrupt the overdose process. Sorry for paraphrasing. Go with it. How else do first responders handle cases involving fentanyl? What does it look like?
So fentanyl comes in a lot of different forms. We don't always get to see where the fentanyl came from, how it was packaged. Some people don't even know that they were given it. There are a lot of people that are surprised that they were given a medicine or they were given a pill by their friend, and it included fentanyl in that pill. So an overdose is called into dispatch, or we're called for an unresponsive patient, and some of the information through good detective work and good questioning, we start getting more and more of that information. One of the things we look for is respiratory depression. Somebody that's not breathing very well, usually these narcotics slow the breathing down tremendously to the point of stopping. So that's one of the first things that we look for is the slow respiratory depression. If we don't understand what possibly is causing that, we can use different medications and different treatments, and Narcan is one of those treatments.
One of my last questions for you, we discussed a little bit in our planning committee meeting about dirty fentanyl. Can you talk a little bit about that, what it looks like, and what that looks like with fentanyl crisis here?
So, fortunately, we have not dealt with dirty fentanyl. One of the things that you've probably seen, or you may see on the news here coming around, is that they are cutting the fentanyl with a new medication called xylazine. Xylazine, for those who are not familiar, is an animal tranquilizer. Most people think, well, why in the world would you put an animal tranquilizer into a narcotic? Well, the idea is to increase the intensity of the medication and to reduce the cost. So therefore, we're going to give you another medication. The problem is that the medication Narcan that we give only blocks the opioid receptors. It doesn't take care of the medication, the xylazine, or street name is Trank. It doesn't affect that. So this medication that they take, they think that they're just using fentanyl. So they're expecting the Narcan to work and bring them right back. The problem is we give them Narcan and nothing occurs. They continue to be sedated and respiratory depressed. So they're seeing this more and more on the coast, and it's moving this direction. I believe Central County since the day have actually had cases over there. So it's not a matter of if, it's just a matter of when it takes place. There is no antidote to xylazine. It's an animal drug, and there are no medications for human usage. So at that point, it is we're going to usually put a tube down someone's throat and breathe for them until either that medication wears off or something else.
Since we're talking about medicine, can we pop over to Dr. Padre real quick? I want to talk about this just from your experience as a medical professional. Can you we've heard a little bit about some signs of what a fentanyl overdose looks like, but for the public, if we encounter something, what should we know, what should we be doing?
Well, so actually our first speakers talked to it about the color of their son's skin, and so a lot of times you'll see a purple or blue to them, which is almost a unique thing for fentanyl. But they'll be cold and clammy, their breathing will be slow, their pupils will be very small. They're going to be typically going to be more unresponsive. It definitely slows them down.
So what are the deeper effects of fentanyl on the body? What long-term effects might there be?
Well, we use fentanyl all the time for chronic pain, which, by the way, is your next question. So, I mean, there are good medical uses for fentanyl, but long-term use is addiction. When we use it for chronic pain, we don't use the word addiction, but people become dependent on it. But for the street use, it's going to be, you're going to need more and more and more to get the same high, which is another reason why they started adding things to it. I would love to say that I don't know any drug addicts at all or how they act, but I do. And they're really intelligent about figuring out how to mix drugs to make the high better. And so this animal tranquilizer happens to be one that, quote, intensifies it. And that also then intensifies your need for more. So the big thing is that need for more. And the more you use, the better chance you're going to have of an overdose.
Slippery slope. Yeah. So you mentioned that medical fentanyl is used. What kind of conditions is it used to treat? How do we know that someone is using a prescribed fentanyl? Like, what does that mean?
So in prescription ways, it's for pain. So we use it for chronic pain a lot. I'm a hospice physician as well as a family practice physician, if you don't know that. So we use it in hospice if we know we have someone who has maybe a cancer pain and they're going to be with us for 3-6 months. It's a lot easier to treat something with a steady pain dose rather than having them chase pain with a pill all the time. And so in that form, it's a patch. And so they have a little patch that they wear that then delivers this pain medication to them over days rather than having to chase every 4 to 6 hours that pain pill that you would take after you maybe have surgery or something. Now, our EMS uses it for acute pain. So you have something that goes wrong. My example has always been on the basketball court, and you have a kid who has extreme pain. We can give them a little bit of fentanyl IV, get their pain level down so that we can then actually treat them, move them, do what we need to do to get them to where we can take care of them. So one of my things that we have discussed is that you shouldn't be afraid of the medical uses of fentanyl, because I've seen the grandma go pale white and they said they were going to give her grandson some fentanyl. He needed it. Does he need it later? No. But at that moment, a little bit is good, and it is a very reversible drug. So it's a okay one for us to use, especially like on an ambulance, because it's easily reversed if we give a little too much. And we hope they don't, but it's always possible. And I did want to talk about Suboxone just a minute. We talked earlier about us getting strength. That was mentioned earlier about how hard it was for this family to get Suboxone. And I'm also a Suboxone prescriber. So originally the United States government actually limited the use of Suboxone, which is something that we can use in a lot of opioid overdoses. It's a medication that we can use to help keep people off of opioids when they're addicts. We can also use it for pain as well, which is a fabulous treatment. And that limit looked like I had to take extra classes. I had to get an extra DEA license. I was only allowed to prescribe it to a couple of people the first year, and then I was limited to a number of 40 people after that. Now, So the United States government is seeing that we can do some good with that drug, and so I want to give a little bit of hope after that, is that we are seeing that in the DEA license number that you have to have starts with an X. So they're calling it the X license is actually going away, and more physicians will be able to prescribe Suboxone, which will help get people off of opioids and hopefully keep them off. So.
Fantastic, thank you. Is this on? I can talk loudly. So could we pass it over to Shannon real quick? I'd love to hear your perspective. Shannon's from South Central Mental Health, and I'd like to hear what you have to say about it on the mental health effects of fentanyl. So, would you share any trends or maybe broad stories? I know obviously personal information is not allowed, but broad stories about fentanyl, what it looks like in the clinic or from your perspective?
Yes, thank you. In the past 4 years, we have seen the amount of substance that we've done in our substance use treatment services triple when speaking of fentanyl. A lot of what we have seen in the mental health side is the trauma that comes from people witnessing overdosing, the impact it's had on children if they're being removed from the home because of the drug overdose. We're seeing a lot of grief that hasn't been addressed, and we also see some of the things that we're able to come out of it is reintegration with the family and therapy and the family support.
That's fantastic, that last point, and I do want to touch on that a little bit. How, as loved ones, can we support someone struggling with addiction or going through this process? How can we help?
That is a really tough question, and there are different routes you can go, and sometimes it's a combination of all of them. Boundaries, which is the biggest thing that can help a loved one, is boundaries, and that's really hard. And also, as a parent, as a friend, as a spouse, as a child, is taking care of yourself and getting the support and the professional help. There are 12-step organizations, Al-Anon, Al-Anon, Family Anonymous, and having that support group available to you to be able to say, hey, I understand. It's a great support for the family.
Thank you so much. It is hard. There is information, I do want to give a little pause in our panel, to highlight Narcotics Anonymous, South Central Mental Health, and DECA all have tables right in the back, and they are resources. So please ask them questions as well if you know someone or if you'd like to take advantage of their resources. They are here to help. So thank you, Shannon. I want to pop over to our police chief, Mike Colton. We talked a little bit about prescribed fentanyl, and I actually want to talk to you about drug take-back programs and how would someone dispose of a prescribed fentanyl when it's no longer needed, or any other prescriptive drugs?
So each year, usually in early spring, we advertise an event that we refer to as a drug take-back program. We usually have 1 or 2 officers that will go to a certain location. Just as an example, last year, myself and Deputy Chief Murphy did this event at Walgreens last year. This year it was put on at Walmart in the parking lot, and Sergeant Thompson did the event this year. But the drug take-back program is an event where if you have unused or unwanted prescription medications in your home, you can bring them to that location and dispose of them there. What we do with those is we place those in evidence until such a time that they are disposed of.
Okay, so we follow the El Dorado, Kansas Police Department page to learn about those events?
Yes.
Okay, so I want to pivot a little bit. We had a lot of questions come in about liability, legal repercussions. We talked about Narcan. We just want to ask some questions. So is there any legal repercussions for, say, a community business or organization possessing and using Narcan in the instance of an emergency?
No. And that could probably, Stacy can probably follow up on that question a lot better than I can, but no, that stuff's all regulated. So
no one would get in trouble for helping
side effects to Narcan.
So if we were to administer Narcan to you right now, everything would be good, no side effects?
Nothing would happen.
That's good.
It simply reverses the effects of fentanyl.
So, talking about fentanyl, there was actually a new law just passed by the Kansas State House. You and I were talking about it a little bit earlier. That was regarding fentanyl test strips. Could you talk about what that means for our community, what it looks like for harm reduction? Just kind of a basic, high-level overview.
Well, test strips, for one, could be used in the detection of fentanyl. And I believe a little over a year ago, this bill was actually argued in Topeka just over a year ago, and I believe in the past, fentanyl strips were considered a form of drug paraphernalia. They have since changed that verbiage to read that it is no longer paraphernalia.
So it had been essentially illegal to have that
That
strip.
is correct.
Now having it on hand means what for you as first responders and
Well,
the community at large?
It allows people to detect the presence of fentanyl.
So, in an instance, first responder comes across, our Joe and Amy, I'm sorry to use you as an example, Percocet was what their son thought they were using, this fentanyl test strip, they could dissolve the pill with the test strip and they would figure out, hey, that's not actually Percocet.
That is correct. It would, even if it was Percocet, if it was laced with fentanyl, it would detect the presence of fentanyl.
So it's a good indicator.
Yes, it is.
I have something I want to add to that. There's a danger to that, though, that needs to be made aware of. Medication that's made that wasn't made by a prescription company. Prescription companies have to follow a certain way that they make medications to make sure that the proper micrograms of fentanyl is located in that pill. When someone goes to start making fentanyl, and if they don't have the exact medication dose, or they just mix it all up into a powder and they start making that with everyone else, or they start making that into a lot of pills. One of the big problems that people run into is, I took one of these pills and nothing happened. But I take another pill, and the problem is the concentration is different in that last pill that they took. And those concentrations are not monitored by a government agency. Those pills are made by someone who's just out to make a buck. So the pill that you take today will probably not be the pill that you take tomorrow. So you can test to make sure that it has fentanyl in it so that you can get your high. But you have no idea how much fentanyl is in that pill.
That's very important. I think Dr. Conrad has a point on that. And Kelly, just heads up, I'm going to get into
And I also want to point out that in the instance when, as presented tonight, the pill they thought it was a Percocet. Percocet is also an opioid. So Narcan would reverse that drug if they had an overdose to that. So Narcan does not just or reverse fentanyl overdoses. It reverses opioid overdoses, which we have a slew of other medications, including the Percocet, which has got oxycodone in it. And so Narcan would also work on that drug, even if they didn't think that. So if you think someone has an opioid problem of any kind, or could potentially be any drug overdose, Narcan is the right go-to drug to try and save their life. And as Chief said, it's covered under the Good Samaritan law. So even if it's not, and you don't save their life, you're not going to get in trouble for that. And if you do save their life, they're probably going to love you forever. So
We actually will be talking a little bit about resources for Narcan in a little bit. Y'all are jumping way off topic. I don't know why I wrote this one. So this is Paye. And Jordan, I'm sorry, I did not introduce you. Hello, Jordan is a high school student who is here to kind of, not put on the spot, represent the youth and share her opinion and her perspective. So, this is Paye, if I could start with you. What kind of education or how are schools educating students about the dangers of fentanyl use right now?
Well, for years, we've been doing the DARE program. So our kids are getting educated in drug abuse and use and dangers. Specifically fentanyl is coming. But I'm going to get on a little soapbox here, and I appreciate so much what Joe and Amy said, because they used the word gateway. And if you guys think your kids aren't vaping, we have a vaping problem in this town. And not just in this town, but in this country. And that's where their son got started. We have fifth graders vaping. And we can educate and talk to them about the dangers, but when we find a kid who has a vape at school, 95% of the time they're getting it from an older sibling or a parent. So we've got to educate parents. We've got to educate the community. We have to talk about what's going on in your home and why your kids are getting a hold of these. And don't get me started on the companies that sell them in cherry flavors. I mean, they're making them way too appeasing to children. But we are going to be getting with DECA, and I appreciate so much applying for a grant. And part of this coalition also is how to spend some of the money that we received from the opioid tax settlement. And one of the things we're going to do, we have health classes that every single seventh grader is mandated to take, and then we have health classes that all of our freshmen are mandated to take. So we will be bringing in speakers and just having general information for our kids that every student will be mandated to listen to and hear, and at least have the opportunity to know about the dangers. But as you all know, talking to kids whose frontal lobes aren't formed, it can't be just a one and done. That education has to continue, and those discussions have to happen at home.
Absolutely, and I'm going to ask Jordan here a question in a second. But for all of you watching this PowerPoint jumping up behind me continuously, there will be a QR code every now and then that pops up from the National Fentanyl Awareness Group that helps organize this nationally. They do have resources for parents, for educators, for family members about how to have those conversations, because it's not easy kind of conversation to have, and they know that, and they want to help support. So if you see, I think it's just fentanylawarenessday.com, but there will be a QR code if you're interested in pursuing that as well, a resource available for you. So Jordan, real quick, as a student, what is your perspective on all of this? What do you see, if you're willing to share, as a student, what does it look like in schools?
So we live in a generation that's full of social media, that people can make private accounts that only certain people can see, your parents can't see. And then you see your friends doing things that you never thought you'd see your friends do. And then you see a picture of yourself posted where there's things in that picture that you wouldn't do, that the people around you would do. And just a couple weeks ago, we had a speaker come to the high school and talk about your digital footprint, and how in today's day and age, when you want to apply for a job, they're going to Google your name, and they're going to see your social media accounts, they're going to see that you did this and you did that. And there's a chance you can't get opportunities because someone else posted something.
It's very real. And I kind of want to touch on that a little bit with Mrs. Tiny. Sorry, flip that before. So when it comes to the health classes and things, we're working on getting education about drugs and making good choices. What kind of tips can you give for the loved ones in the audience? I mentioned that resource online, but you're a counselor. You have hard conversations all the time. Is there anything you'd be willing to share with words of wisdom, maybe?
Well, I think it just has to start with honest conversations. You can't be afraid anymore. I mean, it's scarier to be facing down, the principal when your child's been caught with it at school. Have those conversations way before that. But, and again, it's going to take a village. It's going to take all of us. Teachers talk about it. Our SROs do a wonderful job. If kids get caught with it, they have to go through a program. They get ticketed. I mean, so, we take it seriously. But, like Jordan said, they're posting their activities. They're showing us what's going on. So, laws need to be tougher, consequences need to be tougher, because I'd rather hit them at a vape than hit them at the fentanyl overdose.
Absolutely. In the event that a fentanyl overdose occurs or something happens, are the schools equipped with Narcan? Do they have those resources?
Yes, our SROs, our school nurses, and our administrators have all been trained, and we have Narcan in every building.
Fantastic. I want to pivot over, speaking of Narcan, to right next door, Jennifer. Hello. Jennifer's from True Care Pharmacy, and I want to talk to you about Narcan and what insurance looks like, because Joe and Amy brought up a good point. Insurance is rough for everybody. And so what can you tell us about Narcan? What are options in the insurance realm for accessing that?
I'm going to kind of jump around on your questions too, because I feel like it's kind of a process. What is the process? And that is part of the process to getting Narcan. Anyone can get Narcan. All you have to do is walk into a pharmacy, talk to the pharmacist, at least one other pharmacy in town, does also do this. The state has given us a statewide protocol, so there's one physician that has given protocol for us to be able to, prescribe, and normally pharmacists would not be able to prescribe medication, but we can with this one. So we can then dispense to the patient or a caregiver, anyone that would like to have Narcan. We look at it as maybe you should have one at home for safety kit, just to have one around. You never know when someone would need it. Then we would bill insurance if the patient or the caregiver has it, whatever insurance is available, Medicare, Medicaid, commercial insurance. And it's subject to co-pays, and that's going to vary per patient and per situation. So for example, a patient on Medicare or Medicaid, it would be free. Some Medicare plans I've seen that are a little higher. And then commercial plans, we have a generic product, so it's usually generic. I know if it's too expensive, we usually tell people about the DECA resources, and I'm sure you'll go into those as well. And then we do have to educate, it is part of our protocol to educate on using Narcan. So I want to stress that, like I said, you do not have to have, you do not have to be the person, you just can have it in your house. I do suggest that you get a new one every year to watch the expiration dates, they do expire. Did I answer all the questions?
You did it so well. So this is not a commercial for our local pharmacies, but I would encourage you all to potentially put Narcan in your first aid kit. I think that's a great actionable item we can all take away, just in the event of an emergency, because accidents happen that we can never prepare for. So,
And even if you have someone that is taking an opioid, whether it's Percocet, Fentanyl, and they have it in their home, you never know who's going to get hold of it. And they may take, or they see someone else taking this, already been taking it for a while, and that's too much. It can be detrimental very quickly. So, I don't think we've discussed in our education, we always discuss how even if you give Narcan, that's not the end of the road. You have to call 911. Narcan lasts, the effects of it start working pretty quickly. It peaks out in a few minutes, in about 15 minutes. And then it's going to begin to stop working. So those opioid effects are what we reverse can come back. So we need to get them to a hospital where they can be treated.
thank you so much. I do want to pass it down. Thank you, Stacey, for volunteering. Well, you're next, so this is your
I think it's important to add too that Narcan is safe for children and even pets. So if you have a child in your home or a pet that gets in the garbage and has, you have pills in there and you're serving that up or something, you can use it safely on anybody. So I think that's important to add as we look at bringing Narcan in to our home.
So on that note, Stacey is from DECA, and could you just quickly introduce what DECA is and what you do for the community?
I'll just go through all the questions you have. First of all, is everybody okay? Some heavy stuff tonight. Everybody doing okay? Take care of yourself? Okay, great. I'm going to come to you with some resources now. So hopefully give you a little hope, some resources that you can utilize for yourself and your community, and we can start to do some change and do some community work here in El Dorado to make a difference in what's happening with the fentanyl crisis. But I'm with DECA. DECA is a social service agency. We have inpatient outpatient treatment services. We have prevention services, which is where I work. We have family preservation as well as foster care and adoption services. We have been around for about 40 years, and our headquarters are in Lawrence, but we have offices here in Wichita, Winfield, Mission, Kansas, Pratt. We also have offices in Oklahoma, and Missouri, and Iowa. So we're really spread out across the Midwest. But we, prevention services-wise, my job is to work with communities to give them training and technical assistance to prevent and to reduce use. That's what I do free of charge for 18 counties that I serve, and so I serve El Dorado in that capacity as well.
And so we work with communities to do those things, alcohol, vaping. We can work on all of the substances and help you implement strategies that are evidence-based and effective and we know work because we've seen it work in other communities. And so you're not just throwing dollars at something that's not going to work. And so that's what we want to do is evaluate those programs and make sure that it's reducing the use and doing what it's supposed to do. But we have a huge naloxone program that we have started at DECA to handle the fentanyl crisis, and we offer several resources that are free to our communities. And one of them is we have free naloxone that you can receive. You can get on our website. It's DECA.org, and I have a huge resource table. Please take everything back there so I don't have to tote it home. That would be great. The tote thing gets a little heavy. So take all those resources, but we can give out free naloxone to you. So if you want one individually, you can go to our website and request that, and it'll be sent to you. If you want some for your organization, you can also request that on our website as well.
Just to jump in real quick here. Naloxone is also used synonym for Narcan. Narcan is the brand name.
Narcan is the brand name. There's also a brand called Cloxato that you might have heard. That's a brand name as well, but it's all the medication is naloxone. And so that's how we refer to it. But yes, Narcan. So you can request that online and get that for yourself. If you have a business or an organization and you want to create policy around the storage and administration of naloxone in your business, we can help with policy development. There's actually a stipend involved to do that, so you get like free money to work on a policy, which is always great. And then we also have training, which is a big component of what we do. And so we don't just say, here's some free Narcan, but we arm you with knowledge about what an overdose looks like, what those signs and symptoms are, how you can respond, and how to use Narcan. And we also give a lot of information on stimulant overdose as well. While opioids is an antidepressant, stimulant overdose is also a real fear, and how to respond to that as well. That training is about 40 minutes. It's not long. We have a self-paced course on our website that you can go through on your own. We also have a monthly general session webinar, which you can watch virtually. And we also do in-person events for audiences that are larger. We can come into, we've been in hospitals, we've been in school districts, we've been in jails, law enforcement. So we can do that free of charge throughout the state of Kansas. And so we offer those resources in regards to naloxone. That was very long, I'm sorry.
Hey, no,
I could talk for days.
I love it. I'm very grateful that you're here helping our community navigate this. So just to quickly recap, you can visit her beautiful table back there for all the resources she mentioned, as well as DECCA.org to take advantage of those free resources, get training, brush up on your knowledge, just get a better mental, I'm planning to do it, get a better understanding of what all this is, because it's new to me, it's new to all of us. So thank you so much, Stacey, and thank you to all of our panelists. You have something? Okay, excellent. Please.
The FDA did just approve Narcan for over-the-counter use. It's not available yet. We read today that it will probably be available sometime this summer, and will run around $50. So just, you can look for it. It should be on the stores, it could be on the shelves. It could be anywhere. Grocery stores, department stores.
So $50 for peace of mind in our first aid kit. I like it. Okay, now is the time that we will pivot to audience questions, as well as so if we have any, who wants to speak or? Oh, great, thank you.
Thank you all for doing this and for being our panel discussion to be for any of you. It appears as a citizen of the community that the fentanyl overdose cases and deaths are really underexposed to the point that many may believe that it's not going to happen to me or it's not going to happen in our community. The fear factor is insufficient for deterrence. Is there a running list of the names of those who have died from this that is happening, and or could such a list be begun?
Hello?
Hello? Okay, so due to HIPAA laws, that will not be. We can't put out the names. Now, their individual families can, but we cannot. But we also agree with you on the fact that there are deaths happening and people aren't aware of them, and that's one of the reasons why we wanted to very specifically pick today to have our first town hall meeting, because it is National Fentanyl Awareness Day, and we want this community to be aware that overdoses are here and people are dying from them, and we don't want any more. And so, no, we won't be listing their names, but the family members, if they would like, could. We have estimated totals. The biggest problem with that in our county, with giving you an absolute, this is how many, is that a lot of times they are shipped to other hospitals. Because like right now, we don't even have our ICU open up at Susan B. Allen Hospital due to lack of staffing. And so if you need to go to an ICU, you're going to go to Wichita. So our EMS is putting them on an ambulance and shipping them to Wichita. So Sedgwick County is seeing what they actually had in their system versus us. So that's why we have to go with the suspected 620 overdose cases that we've had. And then 106 this year. So, that's the reason for that kind of little discrepancy, is because of where they're actually ending up in the hospital.
Yes, I wanted to ask, what is Delta 9? I've not heard of it, and also, how do you store Narcan to take special storage?
Storage is great. Narcan or naloxone is just room temperature storage. No special storage. It's just room temperature. You don't want it to get too hot, so you don't want to leave it in the car. But just room temperature storage is good.
And what is Delta 9? Anybody?
So I'll do my best as far as Delta 9 goes. Different derivatives of THC, different levels of the amount of CBD and THC, and the amount of THC that is allowed by legal statutes in Kansas that says your product can only have a certain level of THC in that medication, and if it is slightly different in chemical combination, it may not necessarily contain the amount of THC that you think, but it still may have some of the similar properties of that. One of the things we run into with fentanyl, I'll just a quick little anecdote. The DEA is constantly sending out notifications to physicians and pharmacies and things like that. Every time someone changes a slight chemical combination to fentanyl, the DEA has to put that into an illegal substance. Just by changing a little chemical combination, that changes to fentanyl. There for a while we were hearing about this elephant fentanyl that was going around, carfentanil, which was 1,000 times more powerful than fentanyl, which is very scary stuff if you think about that. And there are thousands of different combinations of this fentanyl molecule. So Delta 9, Delta 8, all those different are just different chemical combinations.
Can you hear me? Okay.
It kind of flew under the radar of the Farm Bill, the way I understand it too. It's supposed to be for hemp production, and there was a loophole, and if you know anything about those who create drugs, they're always going to find the loophole, and that's what happened with Delta 9, and our legislation just hasn't caught up to bring that out of the counters. But I wanted to say one more thing, if it's okay, in regards to raising awareness. The gentleman that talked about putting the names up. We've learned in years of prevention work that scare tactics just, they don't work. And so while providing education is key, we need to be looking at what we call protective factors. It's how can we make our kids more resilient? How can we create connection in our community? How can we work on attachment with parenting? And so while we need to focus on the educational pieces and the harms, and here's are the signs and symptoms, that's so important. But the work that we do, that we value so much in prevention, is really working to just make strong communities, people that can have those conversations and do the work in schools to create resilient youth and resilient adults. And so that's kind of where I think we should go with raising awareness.
This is more of a statement, sorry about that, but I sell health insurance, and while yes, absolutely, health insurance is not perfect. I was naive to all of this happening in our area until about a year ago when a drug rehab center in Wichita started sending people my way when they would show up at their door trying to get drug rehab. And if they don't have insurance, they can't get in. And so these are people wanting help right now. And they're told, well, call this lady, she'll help you. And let's say that person calls me today, the soonest that health insurance can start is June 1st. And so I have to tell these people, yes, I can get you a plan through Marketplace that will start, and you can go into drug rehab as soon as it starts, but it's not going to start till June 1st. And they literally are sobbing, what am I going to do for the last few weeks? And if you know anything about folks who are battling addiction, if they're ready to get help now, you can't get them help now. And so if you know people who are struggling with addiction, you know, they're taking the Narcan, this is stuff happening after these overdoses. If you're a parent or loved one, get them some help. Marketplace plans, while they're not perfect, they do help in these situations. They do cover drug rehab, outpatient and inpatient. And so that's just one of those things that after all this is done, let's get them the help they need.
As an employer in the community, I have a question as to, for any of you guys, what would you suggest be the main course of action if you have someone come up to you, such as an employee or any citizen, a loved one, that asks for help, but they don't have resources? So they don't have a cell phone, they don't have a car, like Wichita, they may not have health insurance. You know, what types of things can we do locally to get them started on that? You know, where do we send them other than, you know, DECA, which is in Wichita, that's great, but how do we get them there?
We do have a treatment program at South Central Mental Health. The state of Kansas has a program called a block grant. Unfortunately, here in Butler County, we do not qualify for that block grant, but we do have connections with other agencies throughout the state that once a person comes in, we can get them assessed, we can get them referrals down to detox in Wichita, and we can guide them in whatever direction that they need to go. We work closely with the 12-step community. We have 12-step members who are willing to talk to people once we get done with them, if they're wanting to go to a meeting, if they're wanting that extra 12-step support, they're willing to talk to them also. So there are resources. South Central Mental Health is not the only program here in El Dorado. There is also Seventh Direction, and in Augusta we have addiction recovery services also.
Quick question for those using Narcan. If I suspect that someone is overdosing and I'm thinking about administering Narcan, are there side effects or adverse reactions I should know about? For example, if they are not on opiate and I think I'm wrong in my estimation that they need that Narcan, is there a downside or a side effect of that Narcan that I should know about?
If you have Narcan in your hand and you think someone has overdosed and they need your help for it, just do it.
Okay. That didn't answer my question.
It does. If it's not an opioid, if it's not an opioid overdose, you're gonna do no harm to them whatsoever.
That's what I want to know.
So,
Thank you.
it is the answer, just do it.
Also, is Narcan a one-time use? Once you use it, you're done?
So most of the Narcan comes in a box with 2 nasal sprays in it. And so, as they had alluded to earlier, Narcan has a limited window that it works, and it's shorter than most of the opioids. So you would give the first dose, and then once you give that nasal spray is no longer good. It's a 1 dose per spray, so there's 2 doses in the box usually. But the idea is give the spray, call 911. And then as the ambulance is coming, if you need another one, you have that second one in the box. And you may need to use it.
If someone has fentanyl in their system and you're around them, will that affect you? I mean, I was told by someone that there's been some, like police officers that come in contact with somebody that has fentanyl in their system and maybe there's dust on their body. Would that affect them?
So probably what you're hearing about is there are the fentanyl patches that I alluded to that we use for like cancer patients for their pain. If you do not get those taken off correctly and you touch the patch, you can actually get fentanyl from that, but not just being in the room with them. The other thing that you should, since you brought that up, that you should be aware of is if you do think someone around you has fentanyl or you are a family member helping someone with like a fentanyl patch, after you touch that patch, you should use soap and water to wash it, and that will eliminate your potential for getting fentanyl. However, hand sanitizer will increase your risk of you getting fentanyl. So, soap and water is a good thing.
Ken, do we have anything from the live person? Not yet.
So we did have a question that was submitted. Oh, man, I was so ready with my script. Go ahead.
What if you don't have the article or whatever it's called, and you need somebody OD? Is it first CPR? I mean, if we don't know if they have drugs in their...
If they are not breathing or they don't have a pulse, it is appropriate to give them CPR. And as we said earlier, they have to have a pulse for the Narcan to work. So if they don't have a pulse, you should start CPR, call 911, and then if you get the pulse back, then Narcan would be appropriate at that time.
Okay, and also, are there any programs set up for people to learn CPR because of this regulation?
Fantastic. You know, the good thing is that everybody here can do CPR. It's called hands-only CPR. Now, not that I'm discouraging you from coming and taking one of our classes at Butler County EMS. We have a public outreach officer that loves to teach CPR. But I will tell you, there was a scary stigma mouth to mouth, and people were afraid to do that. Hands-only CPR is saving more lives nowadays than we've ever seen. Our survival to discharge has increased so much because everyone is going to at least start pushing their hands on someone's chest to start that blood flow. Every time you push on their chest, that's going to cause some type of respiration. So, calling 911, getting that help on the way. If you need to, you're going to start the CPR just to keep them going.
So really,
Does most of the fentanyl come across the border?
probably, yeah. But I was going to go back to the that's the rhythm in which you would like to push on somebody's chest, so just sing it. And then my fellow panel member here mentioned that we might want to tell you what happens to a patient if they are opioid overdosing and you give them Narcan and you're reversing it. Stand back, they might vomit on you.
What about the, coming across the border? Is there something that can answer that more clearly?
The answer to that question is unfortunately yes. Most of it does come across the board.
So I was going, go ahead.
Real quick, the DEA website has a lot of information about where the drugs are coming from and track all that. They have a lot of good resources for families as well and have some media campaigns. It's a good resource to check out, DEA.gov.
We were talking about the nasal spray, and we also talked about how it can slow or even stop breathing. How effective is the nasal spray if they aren't breathing?
That's a good question. So the nasal spray attaches itself to the mucosa in the back of your nose, where the blood is flowing through. Basically, it absorbs in through those passages, and it enters the bloodstream through the nose. And the idea is that, like I said earlier, if someone doesn't have a pulse, that Narcan is basically going to sit in their nose. But as their pulse is going, it starts to absorb into the bloodstream through the nose and will get into the bloodstream and start reversing all those opioid sites.
Can you talk about what the illicit fentanyl looks like to the general public and how it's used by the addicts?
Fentanyl in general can come in powder form, it can come in pill form. Again, it can be laced with other pills, it can be laced in marijuana. So the look of it can be different each and every time. What was your other question related to that?
How is it used?
Yeah.
I'm sorry.
How is it used?
Most of the time, most commonly, I believe in pill form.
Can you tell us how long the fentanyl side effects last? Like if someone took something and they told you I'm on fentanyl, they haven't overdosed, but how long do you need to keep an eye on them if that's the case, if they take it illicitly?
I believe the time is 4 hours. That half-life of fentanyl is about 4 hours. Again, half-life is 4. Yeah. Hours. Let's just call it hours. Because all depends on the amount that they took, how it's put in the form, how long it's going to take for it to be digested, and then metabolized.
So you said 4 hours is prior half.
I need to confirm that. I'm not 100% sure. I believe it.
That was not a question they had me prepared for. But what I would say is, quite typically, it depends on their metabolism and how they're metabolizing that. And so saying a specific hour number is really, you have to watch them until the side effects wear off, which will be hours. And then I would say add an hour or two on after that. So I would say somewhere between 6 and 12 hours I would be watching that patient.
Can you talk real quick about the side effects, just to remind everyone what the side effects you just mentioned are to look out for?
So the slowing of the breathing. In fentanyl, they have some kind of, they have a bluish purple tinge that they can turn. They get sleepy a lot of times. Their breathing slows. Their pupils will be tiny. So pretty lethargic.
I just wanted to add on what you were talking about, the trend that we're seeing more and more here in El Dorado is the smoking of fentanyl also and snorting. So it seems like in the past few years what we've seen is not only are they taking it orally, but they're starting to use it in other ways too.
quick question. Oh, you guys, please.
So we're trying to use overdoses when people are going to the hospital. And in my experience with the hospital, the person was in ICU for a week. He was on a ventilator for 5 days. He wanted rehab, he wanted help. And the hospital gave him no resources, nothing. Are they doing anything to correct that?
So I'm going to defend our local hospital a little bit. And that is right now we don't have an ICU. So they're not coming out of our hospital with this. They're coming out of Wichita hospitals. And I have no recourse on that. I'm hoping at some point we can have our ICU back up and running here in town and that they will be coming out of our hospital at that point. But really, honestly and truthfully, you as family members need to be advocates for them because there's not a good, this is what we do with an addict and this is how we get them help, and it's not taught. When I was a resident, I happened to be lucky enough to train with the physician that runs the methadone clinic in Wichita, and so I got extra training in drug addiction that most residents don't. And so most physicians don't have a lot of training in this, and they don't know what to do. They're just as lost as you guys. They just don't want to admit it because we're supposed to know. So my recommendation in that is make sure that they have a primary care physician, whether it be an internal medicine, family practice, somebody that you can take them to that will help you get hooked up with those resources. And I will tell you that the physicians here in town, most of them would help you get hooked up. So find that primary care doctor.
I just have a comment about resources. There are resources for people seeking help with drug addiction. There's a place called SAC in Wichita that will hook you up with getting assessed for treatment. And lots of times you can just get in free for detox, and then we'll assess you to see if you need outpatient or inpatient treatment. Also, there are several places that you can get in for sober living. You just have to get a hold of anybody in an AA group or an NA group that have phone numbers to these places. Any of us can help you with that kind of thing. There's an AA house here in El Dorado. There's an NA house here in El Dorado. There's a Second Chance, Oxford House. There's places like that you can get hooked up with. It's really not hard to get into treatment if you want to get into treatment. It's just that that information is not available to people. You just have to know the right people. Hospitals don't have that information. It's just people in these AA and NX places, we do have that information. So you just have to look in the right places. So that's why we're here to let you know that resources are available. You can get into treatment.
Thank you so much for sharing. We have time for 2 more questions, and this gentleman has the floor.
There's a lot of good information, but at the end that you tell us a lot of people interested. What can we do as a community and a county to help combat this? I know the first speakers talked about they tried contacting our legislators. I do want to thank Senator Back for coming in. I mean, that's a good place to go to if that's what we need to do. What can we do as a community and county to help combat this? Do we need to contact legislators or what?
Well, I'll touch on that first, because I really feel like what we're doing here tonight is the first big step in answering that question. We have to work together. If we work together and we get our legislators involved, we get our county commissioners involved, our city commissioners involved, and having these conversations, then we have a better chance of saving lives in our communities, in our counties.
On that note, we do plan on having future events like this. So this is not the first and last. This is the first of hopefully many of this type of conversation. Trainings, town halls, resource programs, which I think Stacy might be getting ready to talk about.
Sorry, I was just going to add something. We've learned in the prevention field that effective community work that really moves the dial on usage starts at a grassroots level. It starts with you all. So if you're looking at us going, well, they're going to solve the problem, no, we're looking back at you and saying we all have to solve the problem together. And when we're talking about educating our medical professionals, that's what we can work on as a committee, is how can we get education in their hands that they can get into the hands of patients? How can we educate parents to talk to youth? It's so comprehensive in all the areas that we have to address this. And so I encourage you and I challenge you to be a part of that solution as well. I'm sure we would love to have you on our committee. I'm speaking for Chief, but we would love to have more people on our committee to help with that messaging and hear your voices, because in the community, that's the strongest thing, and that's what's going to make the most change in El Dorado.
Ms. Baldwin, I have one more question, if I can get it in.
About 30 seconds.
As a former educator, I used to take kids out and clean up things and pick things up. I don't know how these drugs are transferred and moved around. Is there a danger to a group of kids that an educator might take out and maybe clean up some area like the park? Is there a precautionary note on this point?
That's an excellent question. So we've talked about fentanyl and the patches and things like that. It can be transferred through the if you're not cautious. So gloves are important to make sure that you are wearing a glove that has the stuff that you pick up, and washing hands immediately afterwards. That's going to be very, very important. With soap and water. Yes. With soap and water.
All right, I lied to you. We will take one more question. Go ahead.
Earlier you were talking about the Narcan, and you said it comes in 2 doses. And you said that we may need to use the other dose. How do we know when we need to use the other dose?
So again, what we're looking for is the same signs and symptoms. We've given the first dose, the patient starts to breathe again. They start to become a little more oriented and alert. And that's going to slowly start returning. They're going to become more disoriented. The breathing is going to slow down. That purplish blue color will start to return. And basically what will happen is the exact same thing that happened before. As the time goes on, that medication is not worn off. So that second dose of Narcan needs to be given.
I think that's great. 3 takeaways, 4 actionable items. 1, we talked about the signs. Someone's maybe turning a little blue, they're a little lethargic looking. Know the signs, be prepared, have Narcan in your first aid kit, know how to access resources, know what's available in our community, and always call 911, even if you're maybe just questioning. They're here to help for that exact reason. So I will take this time to close the town hall. Thank you so much to our panelists for taking the questions. Can we give them a round of applause? So obviously this is a complex issue, and we talked about having future events. So there are ways to contact everyone on this panel. Feel free to ask them directly or visit the El Dorado, Kansas Police Department Facebook page. Let us know what you'd like to see. There would be potential, we've discussed as a committee, future Narcan trainings to get more in-depth training aside from those 3 quick facts that I just mentioned. More resources that could be available, that sort of thing. So thank you all so much for taking the time to share your voice, share your thoughts, and share your questions. Have a great night and stay safe.